Hello, my name is Josephine Masida, and I'm going to talk about the respiratory system. And the respiration is the way we breathe in air and the way we breathe out air. The objectives of my teaching, I'm teaching a pre-licensure nursing student. The objective of the teaching is at the end of the teaching session, the student will demonstrate understanding of the respiratory system. The other objective is that the student will be able to explain the inhalation, which is the breathing in, and the exhalation, that's breathing out process. The third objective is that the student will be comfortable in answering questions related to the respiratory system. To start off, the respiratory system is found in the right side of the thoracic cavity. That is this side of the thorax, on the right side. So the right side, the left side, we have the heart, and then the right side, we have the respiratory system. The respiratory system is a series of organs which are responsible for taking in oxygen and exhaling carbon dioxide from the body. The functions of the respiratory system are as follows. The lungs or the respiratory system helps in supplying oxygen to the body for energy production, removing of carbon dioxide, which is a waste product of energy reactions, maintaining homeostasis, that's a balanced base of the arterial blood, and the last function is maintaining heat exchange in the body. By supplying oxygen to the blood and eliminating excess carbon dioxide, respiration maintains the pH of the blood. The different parts of the respiratory system are as follows. The primary organs of the respiratory system are the lungs, and the lungs are located in the thoracic cavity, like I said earlier, on the right side of the lungs. And when you auscultate the lungs, when you listen to the heartbeats, you can listen to the heartbeats either at the front or at the back. You can hear them. Then like I said, there are two lungs. There's the left lung and the right lung. So there are two. The lungs are divided into 5 lobes: the right lobe, the right middle lobe, the right lower lobe, the upper left lobe, and the lower left lobe. The left lung is smaller in size to allow room for the heart, which sits adjacent to the lungs on the right side, on the left side. So as we breathe, oxygen enters the nose or the mouth and passes through the sinuses. The sinuses are hollow spaces in the skull. The sinuses help regulate the temperature and humidity of the air we breathe. So when you breathe in, we breathe in air, it goes through the sinuses, and then the temperature of that air is regulated. The air then goes into the trachea, also known as the windpipe. The trachea filters the air as it's inhaled. The trachea is divided into two bronchi, and these also carry air like into both the lungs. So the trachea, when you breathe in, you're gonna breathe in. So the air is gonna go through the trachea, and then the trachea is gonna divide into two, and then each of the two bronchi is gonna go, like, one is gonna go to the left side of the lung, and the other one is gonna go to the right side of the lung. And so then the average rate of respiration differs depending on age. A newborn normal respiration rate is 40 breaths per minute, and the average respiratory rate for an adult is between 12 and 16 breaths per minute. The human body needs oxygen to sustain itself. A decrease in oxygen in the body causes a condition called hypoxia. Hypoxia will mean when someone is hypoxic, it means like they have less oxygen in their body, and this is hypoxia is fatal, and someone that has this condition, within 4 minutes they can the brain cells will die, and eventually the person will also die because lack of oxygen in the brain damages the brain cells. The bronchial tubes, it's mixed up. The bronchial tubes are lined with tiny hairs called cilia. Cilia moves back and forth, carrying mucus up and down the lungs. So the mucus is the thick stuff that we cough up. Sometimes if you have a cold, you'll cough up mucus. It's sticky, and it's the fluid that collects dust, germs, and other matter that invades the lungs. Mucus is expelled from the lungs when we sneeze, when we cough, when we spit, or when we swallow. And then the process of air exchange in the lungs, this is how it happens. The lobes of the lungs are filled with spongy sacs called alveoli. This is where the exchange of oxygen and carbon dioxide takes place. The alveoli walls are composed of tiny blood vessels called pulmonary capillaries. The pulmonary artery carries blood containing carbon dioxide to the air sacs in the lungs, where the gas moves from blood to the air through exhalation. So when we breathe in, this air goes into our lungs, and the alveoli, that's where the air exchanges. So the blood that contains oxygen goes in, and then the blood that contains carbon dioxide is expelled out. So the pulmonary vein carries the oxygenated blood from the lungs to the heart, and then the heart will pump that blood to the rest of the organs of the body. Then the red blood cells collect oxygen from the lungs and carry it to all the parts of the body where it's needed. During the process, the red blood cells also collect carbon dioxide and transports it back to the lungs, from where it leaves the body through exhalation. And exhalation is breathing out. The diaphragm. The diaphragm is a dome-shaped muscle. It's like at the bottom of our lungs. It's between the abdominal cavity and the thoracic cavity. So that's the diaphragm right there. It's dome-shaped. It's kind of round. The diaphragm rests at the bottom of the lungs. It controls breathing and separates the chest cavity from the abdominal cavity. When a breath is taken, when we breathe in, that's inhalation, the diaphragm flattens out and pulls forward, releasing the space, increasing the space in the lungs. So when we breathe in, so the diaphragm comes up and it flattens. It increases the space in the lungs, and then when we breathe out, the diaphragm expands and forces air out of the lungs. So it's a very important muscle. We have some diseases that affect the respiratory system. Diseases and conditions of the respiratory system may lead to difficulties in breathing or even respiratory failure. The most common symptoms of respiratory disease is coughing and shortness of breath, which is also known as SOB. Diseases and conditions that fall into these categories. We have viruses such as influenza and pneumonia. We have chronic diseases such as asthma, chronic obstructive pulmonary disease, COPD. We also have lung cancer, which is often associated with smoking. Lung cancer also affects non-smokers. We also have another condition called atelectasis, which is complete or partial collapse of the lung. And mostly this develops when the air sacs, also known as the alveoli, become deflated. And this condition is a complication that happens during surgery when people go to have surgery, and when they start to breathe, they can't breathe because the lungs have collapsed. Treatment depends on the cause and severity of the collapse. Then we have the common diagnostic tools for diagnosing respiratory disease. We have the X-ray, and we also have the pulmonary function test. The pulmonary function test measures how well the lungs take in and release air and how well the lungs circulate the air. And that's my presentation. Thank you much.